How to use Dena disposable electrodes for ECG procedures. This video demonstrates the correct method for using Dena disposable electrodes during ECG procedures. Before applying the electrodes, ensure the skin is clean and completely dry for optimal adhesion. If needed, clean the skin using gauze soaked in mild soap and water. Avoid using alcohol, as it may increase skin impedance and interfere with signal quality. To apply the electrode, peel it away from the plastic liner using the tab on the backing material. Carefully place it on the skin without touching the adhesive surface. Gently press around the adhesive edge using a smooth, circular, and firm motion to ensure full contact with the skin. If using electrodes with wet gel, do not press on the center, as this may cause the gel to spread under the adhesive area and compromise attachment. To remove the electrode, lift the tab or edge slowly, keeping the motion low and close to the skin. Pull back gently, supporting the newly exposed skin as you go, to minimize the risk of skin irritation or trauma. Dena electrodes are single-use and must be discarded according to hospital or clinical waste disposal protocols. Store unused electrodes in their original pouch, ensuring it is sealed properly by folding it twice over the open edge.